Thank you very much. أعوذ بالله من الشرك أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على رسول الكريم وعلى آله وصحبه ومن استنى بسنته يوم الدين قال ربي اشرح لي صدري ويسر لي أمري السلام عليكم ورحمة الله وبركاته. I hope you can hear me and I hope you can see my slide. That's the two most important things. Anyway, I'd like, first of all, I feel very privileged and honored to be among all these eminent people here. And, and thank you, Dr. Riano and Hanam Dover and all the team for giving me that opportunity to say a few things about my experience of meeting with the late Professor Dr. Malik Badri. May Allah bless him and give him Jannah Firdaus. So it was a very blessed opportunity for me to meet Professor Badri. At that time, he was the chair of Ibn Khaldun, Faculty of Revealed Knowledge and Human Science at Iamp. And so it was taken during the visit. I spent about maybe 10 days or so with him. My reason was being there. We corresponded many times before, but my reason was I wanted to develop a course on history and philosophy of Islamic psychology, and I wanted him to be able to be the advisor, but also to contribute to that. And we during the 12 days we made lots of recordings, and some of them I've never seen by public anyway. So there's probably if I can move my slides. I think there is the recording from YouTube that you can see it if you go on that sort of link. And also it's appearing, some of the interview I did with him. Not only we have it visually, but also I've recorded it, and it's in my new book on Foundation of Islamic Psychology from class, inshallah, in a few months by Routledge. So, like I say, I'm extremely, in fact, thankful to Allah to have given the opportunity to spend some time with this really charismatic figure. I couldn't describe anymore, and the doyen of contemporary Islamic psychology. What I like with him very much and I admire, is his modesty. Is his modesty, but also his equality, fairness, justice, and so forth. Anyway, and so I learned a lot from him. I'm still learning from from his work and so forth. And so I like also to thank part of my talk is based on the interview I did with him, but also from the paper which was written by Professor Dr. Rahmatullah Khan, which spoke to you yesterday, his paper, which was appeared in Intellectual Discourse. So thank you very much, Professor Khan, for some of your information. One of the things which I come to that in first minute, we're going to talk about cognitive systematic sensitization. Now, the reason I just want to, for briefly, for the novice, not everybody else is experienced in CBT or system. Just a very brief 1 or 2 slides to explain what it is. Then we go back to Malik Badri's own particular development of a new technique, which I think nobody seemed to really, amazing that in the literature very few people talk about it, because I think this is he invented a new technique, and the people like Wolf and and Mayer and others, all these people in the 60s, really were gave me a lot of credit for that. Anyway, let me come back to that in a minute. So what we talk about, just for the novice, again, bear with me, it's a form of exposure therapy, we can say. It's using CBT or cognitive behavior therapy, and the aim of it is to reduce anxiety, is to restress, and also you can avoidance by gradually exposing a person to the source of their discomfort, of the source of stress or anxiety. But you do that in a planned way. So, but what it is that you include some sort of technique in it, to help relieve the symptoms anyway. And if we move to the next slides, I do it myself, it's that you can see that it's first of all the teaching subject to relax, so relaxation is very important in it. Secondly, people make a list of things like hierarchy of anxiety, and before, and thirdly, they rate their fears, whether their fears are low or in the hierarchy, or the fears are high, and finally they face their fears anyway. That's that, and they combine this sort of desensitization, I would say, the same as with relaxation therapy. But what's amazing is that, this particular principle was done in Medina during the time of Prophet Muhammad sallallahu alaihi wasallam, when he wanted, or Allah really, made laws about, the drinking of alcohol. The drink, for example, very quickly, the drinking alcohol was not done very quickly. Just say everybody stop. No, because it was done gradually with different verses of the Quran. So on. It's the same principle, very much the same principle. There's a paper on it written of the principle of systematization in Medina in reducing alcohol use. Anyway, among the Sahaba and the public as well. Okay, let's move on to battery technique. Now, the way I'm going to do it, is to the two narratives in this particular presentation. One is my own explanation, okay, what I understand, so my own narrative, but also they're going to be Malik Badri narrative in the sense that he spoke about this, verbatim, okay, these are these words. I will tell you when he does. So what I want to focus now is, Malik Badri contribution in developing new, as Prof. Abdullah Rahman mentioned, he had a novelty. He always been creative in his approach to treat client depending on their particular needs anyway. So that was one his creation. That one was what we say his pearl. Wrote a paper about 1966. We'll come back to that. But what he did was to first of all try to humanize the therapy technique, because sometimes you can see that it was behavior therapy. It was very much automatic, as if people live in their head, not the whole holistic sense anyway. So they were very automatic, they were robot and so forth. So what he tried to do to humanize that therapy anyway, And so he combines behavior therapy with talking and listening to the patients, instead of what he said, like quote his word, moving the patient up the hierarchy as if he were an animal, to be conditioned. That was his words anyway, because the way the therapy was done was that it was, like I say, for him, his perception was it's very, it was very animalistic, very mechanistic, very robotic in a way, So he said, it's like we are trying to condition an animal and you try to condition a human. So he tried to humanize it. So when Professor Wolf, John Wolf heard it, he suggested, this alteration in that new technique, it should be published anyway, but he didn't do it straight away. Let's move on to the next slides. So I asked him basically, I know, some people are very familiar with this. So I said to him, could you briefly describe, explain this in technique in very simple language? So he said, that's his word, pretty systematic. I'm just going to read it. Quote, systematic sense that's aimed at gradually habituating the patient by utilizing his ability to imagine graded scene or hierarchy of things or situation that cause him anxiety and emotional disorder. He gave the example, if he had the phobia of high places, the graded scene starts with the first floor and end up with the patient looking down from the balcony, of the 30th floor. That's what he explained and gave an example. they also, talk about that in classical systematic disambiguation that is followed by therapists. Imagination seemed to be continued for a fixed time. People put, in fact, in his time, he said that some of the therapists use a stopwatch. Yeah, and this is basically repeated until he reports between the clients, people know anxiety, and is then transferred to the next. So if during the course of treatment, the client experienced anxiety, he would report it by raising his index finger, okay? And the therapist would bring him back to an early level, to an early stage, to an early item on the hierarchy, and would help him to relax, and later present the same item until he overcome anxiety. So it was a graded thing anyway. And he's ready for the next scene in his vertical trip until he completes the hierarchy. And again, what basically what I said, that forget about this slide, that if the patient experience anxiety while going to the hierarchy of anxiety provoking situation, then you would raise that finger and so forth, and the therapist would stop. And I think we discussed that. Let's move on. Now, what about this new technique? And so the innovative technique, in fact, that alteration to the work method of systematic sensitization, I quote, it said that I applied, in 1965, when I was treating a Moroccan patient, and what he did instead, of silently, it's there in the slide, imagining anxiety-provoked scene as prescribed in work method or approach, I asked the patient to loudly voice in detail what she was imagining. It's changed now. Instead of putting your little finger, no, but we humanize it by saying, right, I want you to describe, I want you to in a way to bring out your feelings. What you was, basically to bring out what you're imagining, also your feeling. And according to him, he said that this enhanced, her involvement and her ability to imagine vividly. And again, his word, this was helpful since research in the field reported that many patients fail to imagine vividly and are embarrassed to inform therapists of their inability. Secondly, in place of restricting therapy, that's his word, okay? In place of restricting therapy to the agreed upon hierarchy that represent only a sample of feared items, I encourage the patient to horizontally imagine and speak about other scenes comparable to so creating anxiety or provoking instances. Now, why did he do that? Because this was done to facilitate the transfer from clinic to real life, because most of this is done in clinic, but he wanted to be real, So in the sense, he did that. So it had turned out that one of the earliest attempts of transforming classical behavior therapy to cognitive behavior therapy, in fact. So whenever the client, I think she Moroccan, she reported much anxiety, I discussed, he said, it with her and help her to change her negative thought. Again, a bit of reframing there, a bit of changing, those negative frame of reference as well. He said that in doing so, and without knowing it, I actually used cognitive therapy that was introduced years after the publication of my article, Alhamdulillah. Again, I just talk about the same thing, so basically he didn't realize he was, like I say, because he tried to innovate, he tried to experiment, as Dr. Abdullah just mentioned earlier, he didn't realize himself that afterwards, it was the earliest form of cognitive behavior therapy. And it only realized that afterwards, years after the publication of his particular article. Let's move on. Thirdly, and as an alternative to unreliable instruction, that is word, okay? As an alternative reliable instruction of raising a finger to signal anxiety, I use a quicker and more reliable instruction of simple asking the patient to stop talking. So instead of raising the stop talking, and whether she experienced anxiety. Because what he said, that raising the finger is unreliable. Again, this was being, in a way, scientific, was testing hypothesis there, being scientific, that because he said the therapist may fail to notice it in time, and patient, as other researchers have shown, may not raise a finger even when their faces, the nonverbal communication express much anxiety. So basically, he said that raising the finger is not reliable. But of course, this was, evidence afterwards, because people did research on that and found that, a lot of patients didn't raise the finger even when they were experiencing high level of anxiety. So I often notice anxiety in the tone of the voice, speaking patient before she stopped talking again. And I think that the idea of raising the finger itself is evident that Wurp and early behaviorists who followed him were extreme, in avoiding speech with the patient. So basically, was Mayer didn't really, wanted to talk to the patient anyway, because they were, very early behaviorists. And fourthly, in combining the gradual approach of sensitization of therapy, I've shown how this combination can be of significance in treating Muslim patients. So you use cognitive therapy, but also you bring that spiritual, Islamic spiritual intervention in his therapeutic as well. So in fact, this was, this paper was basically, in fact, he didn't want to publish a paper, but with the encouragement of Victor Meyer at the Middlesex Hospital. Now, I was fortunate to work not at the same time in the Middlesex, but later on. But and of psychology under the title "A New Technique for the Systematic Desensitization of Pervasive Anxiety and Phobic Reaction." In fact, I think Wolf wanted to call it something else anyway. I think, but he wasn't happy about that, and he sort of he wanted it to be sort of cognitive systematic desensitization. That's what he wanted to call it. And as I said, probably that, and when Dr. Meyer, Victor Meyer, the Middlesex was happy, he recommended his technique, in all his lectures, and started use it, He was the founder of, behavior therapy in the contemporary area. And but he started using that technique and with his patient anyway. And Dr. Meyer informed that he found it superior to classical technique of Wurp anyway, which was a South African psychiatrist anyway. And he gave it the name of behavioral psychotherapy. That's what made it. But he preferred cognitive, as I said, he preferred cognitive systematic sensitization. And many of them, like Mayer and also many others, Seligman, and they all, mention this particular innovative technique in cognitive behavior therapy in their books, in their literature, and so forth. Anyway. And including, like I said, Martin Seligman, positive psychology, and Steve Holland, and many others, of course. Right. This is, in fact, my short and brief session on, that this sort of technique, which is very simple but very creative, very innovative, and if non-Muslim adopt it, then we should be very, very, very proud and try to publicize it as much as we can, like battery psychotherapy, but also battery cognitive systematic sensitization. I shall end up now. Subhanakallahumma وبحمدك أشهد أن لا إله إلا أنت أستغفرك وأتوب إليك. السلام عليكم ورحمة الله وبركاته.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much for highlighting the innovation done by Prof. Malik Badri as a real example of how to Islamize from the Western modern psychology. And the next speaker is Prof. Dr. Tahir